Once we're ready to connect our sensor, we will choose the 3.0 USB port and plug in. You will then get a status of ready. Pushing the start button, we will then arm the sensor. It is recommended to only arm the sensor when you are ready to acquire X-rays. If there's going to be a long pause between X-ray studies, it is also recommended to disarm the sensor. Now we have a status of waiting for X-ray. At this point, the software and sensor are ready for the acquisition or the radiation from your generator, whether handheld or wall-mounted. You can then choose acquisitions several different ways. One of the easiest and great ways to start if you haven't taken X-rays before is selecting places on the dental chart. This can be done by selecting the maxilla for incisors, the quadrant, full sides, or by clicking and dragging across the teeth of interest. Also take notice, the positioner is shaped like our sensor and has our little cable coming out of the back. For maxillary positions, for upper incisors, would look like that. Mandibles, it goes down. Left side, anything upper or lower. So basically this lets us know where our sensor is and how it should orientate itself in the mouth for our images to look proper. If you've chose to not pre-label by choosing a position first, you will not have any work to do after you've taken the shot. If we've taken a shot without pre-labeling, then we can go back later to add those positions on there if we like. If you've taken X-rays in previous softwares that have FMX available, charts that we can pre-shoot X-rays into, by selecting auto mount, we can bring up a number of charts. One of my favorites is one that I've made myself. I'll show you an example. Or some of our canned ones that are there available for you. By clicking maximize, once we've selected the proper chart, we can bring up this FMX mount. We can then shoot images in each one of these little tiles. They are pre-labeled and they're also pre-numbered in terms of acquisition priority. When we shoot number 1, it will jump to number 2, and so on and so on. If we have made a mistake and would like to go back, we click back on that image and reshoot in the tile that is green. When we are finished acquisition, we can select stop or finish. In this case, I want to go back to our acquisition screen, so I'm going to click minimize. By clicking the auto mount again, deselecting it from green, we'll close it. And now we are back to taking X-rays however we would like. When we're finished taking X-rays, we can disarm our sensor and finish acquisition. Now we have images taken for our patient.